Get that trembling, geriatric relic out of my sight before she contaminates my sterile field. The shout ricocheted off the pristine white tiles of Trauma Bay 1, silencing the rhythmic beeping of the EKG monitors. Dr. Julian Sterling, 36 years old and already the chief of trauma surgery at Chicago's St. Jude Medical Center, stood over a patient with the posture of a Roman emperor. He was handsome in a way that looked expensive, perfectly coiffed blonde hair, teeth capped to an unnatural white, and a jawline that seemed to have been chiseled by a marketing team. His finger, manicured and steady, pointed accusingly at Alara Vance. Alara was 64. She was a small woman, shrinking into a faded maroon scrub top that was 2 sizes too big. Her gray hair was pulled back in a utilitarian bun held together by a cheap plastic clip. She wore thick, corrective lenses that magnified the crow's feet around her sad, hazel eyes. To the casual observer, she was the hospital's inventory clerk, the woman who counted gauze pads, restocked saline, and occasionally mopped up spills that the younger nurses were too busy to notice. And she shook. Her left hand had a resting tremor, a constant, rhythmic vibration that made her teacup rattle against the saucer in the break room. I was just bringing the specialized vascular clamps you asked for, Doctor, Alara said, her voice raspy, like dry leaves skittering over pavement. I asked for them 3 minutes ago. Sterling snapped, snatching the tray from her. As he did, he deliberately bumped her shoulder. Alara stumbled back, her orthopedic shoes squeaking loudly against the linoleum. Look at you. You're a liability. You're walking entropy. If you drop a scalpel in here, you could kill someone. I haven't dropped anything, sir, Alara whispered, lowering her gaze. Yet, Sterling sneered. He turned to his entourage of terrified residents. Take a good look, everyone. This is why we have mandatory retirement ages in civilized professions. Medicine is a discipline of precision. It belongs to the young, the sharp, the steady. It does not belong to trembling grandmothers who smell like mothballs and regret. The residents chuckled nervously. They had to. Julian Sterling held their careers in his hands. Go back to the supply closet, Alara. Sterling dismissed her with a wave of his hand, turning his back. Count Band-Aids. Try not to hurt yourself with the paper cuts. Alara didn't argue. She didn't defend herself. She simply adjusted her glasses, hid her trembling left hand in the pocket of her scrubs, and turned to leave. As she walked toward the double doors, the heavy silence of the ER followed her. She passed Benny, the 50-year-old security guard stationed at the entrance. Benny, a former Marine grunt with bad knees, looked at her with soft, sympathetic eyes. He's a jackass, Alara, Benny muttered under his breath as she passed. Don't let him get to you. Alara paused, her hand gripping the door handle. The tremor in her left hand ceased for a microsecond as she tightened her grip. It's fine, Benny, she said softly. Lions don't lose sleep over the opinions of sheep. Benny frowned. What? I said the inventory needs checking. Alara corrected herself, the rasp returning to her voice. She pushed through the doors, disappearing into the gray anonymity of the hospital corridors. Sterling, still preening in the trauma bay, had no idea that the geriatric relic he had just humiliated was not, in fact, named Alara Vance. He didn't know that 30 years ago, in the classified archives of the Joint Special Operations Command, she was known only by a call sign that terrified insurgents across 3 continents. The Wraith. The atmosphere in St. Jude's Level 1 Trauma Center was always chaotic. But that Tuesday evening, the air felt heavier, charged with static electricity. Outside, a torrential downpour lashed against the glass facade of the hospital, turning the Chicago skyline into a blur of gray and neon. Inside, Dr. Sterling was in his office, admiring his reflection in the darkened window. He was on the phone with his publicist. I need the cover of Medical Monthly to focus on the young visionary angle, Sterling said, examining his fingernails. Yes, I know Dr. Aris has more experience. But does Dr. Aris have 3 million followers on Instagram? No. I am the face of modern trauma surgery. I am the brand. He hung up, satisfied. He checked his watch. 1900 hours. Quiet night so far. Just a few overdoses and a minor pileup on I-90. Down in the basement supply room, Alara sat on a milk crate, surrounded by boxes of sterile gloves. She wasn't counting them. She was staring at a photograph tucked inside the cover of an old inventory logbook. The photo was grainy, black and white. It showed a woman in her early 30s, dressed in desert camouflage, standing amidst the wreckage of a burning Black Hawk helicopter. She was covered in dust and blood, holding an M4 carbine in one hand and a bag of plasma in the other. Her eyes in the photo were fierce, predatory, the eyes of a woman who had looked death in the face and spat in it. Alara traced the face in the photo with a trembling finger. "Long time ago, Ellie," she whispered to herself. Her reverie was broken by the screech of the PA system. It wasn't the usual polite chime used to page doctors. It was the klaxon, a harsh, rhythmic buzzing that signaled a mass casualty incident. Code Black, Level 1 trauma activation. ETA 5 minutes. Then, Sterling's voice boomed over the intercom, tight with an excitement he couldn't quite mask. "All attending staff to the ER immediately. We have a high-priority situation. Repeat, high priority." Alara stood up. The nostalgia in her eyes vanished, replaced by a dull, professional glaze. She shoved the photo back into the logbook and buttoned her oversized scrub top. She grabbed a cart of trauma supplies, AB-negative blood packs, central line kits, chest tubes, and began the long walk to the elevator. When the elevator doors opened on the ground floor, chaos had already erupted. Nurses were sprinting with gurneys. Residents were shouting orders that conflicted with one another. And in the center of the storm, standing on a nurse's station desk like a conductor, was Dr. Sterling. "Listen up," Sterling shouted. "We have a catastrophic failure of a diplomatic convoy. We have multiple criticals incoming. But," he held up a finger, "we have a VIP, high-value target. The Pentagon has notified us that General Magnus Thorne is on the inbound bird." The room went silent. General Magnus Thorne, the Iron Bull, commander of U.S. Special Operations. A living legend who had architected the defeat of ISIS cells in Syria and led the extraction missions in Kabul. He was a national hero, the kind of man whose death would shift geopolitical tectonic plates. "The general is mine," Sterling announced, his eyes gleaming with the prospect of the career-defining surgery. "I want Trauma Bay 1 prepped. I want the cameras off. I want the best team. Dr. Miller, Dr. Chun, you're with me. The rest of you handle the collateral damage." Alara pushed her cart quietly toward the trauma bays, parking it in the shadows near Bay 1. She started stocking the shelves, her movements efficient but slow, her left hand shaking as she lined up the vials of epinephrine. "You," Sterling barked, spotting her. "Supply lady, what are you doing?" "Stocking the bay, doctor," Alara said, keeping her head down. "You'll need extra clotting factor if it's a convoy hit. Likely IEDs or heavy caliber rounds." "I don't need a janitor telling me what I need for surgery," Sterling snapped. "Finish up and get out. If the general sees a shaking old woman when he rolls in, he'll think he's in a nursing home, not a world-class facility." "Yes, doctor." Suddenly the building shook. It wasn't an earthquake. It was the low-frequency thrum of heavy rotors. Not the standard medical choppers. These were military-grade engines. "They're bypassing the helipad," Benny shouted from the ambulance bay doors. "They're landing in the parking lot. Too heavy for the roof." Sterling turned pale, then flushed with adrenaline. "Let's go. Meet them at the doors." He rushed out into the rain, his white coat billowing. The residents followed. Alara stayed behind in the shadows of Bay 1, watching. She reached into her pocket and pulled out a pair of unapproved, non-standard hemostats, curved, serrated, blackened steel. She had carried them every day for 20 years. "Just in case," she murmured. The scene outside was apocalyptic. A modified MH-60 Blackhawk helicopter had touched down in the center of the ambulance bay, crushing a row of hedges. The rotor wash was strong enough to knock over trash cans. Rain whipped sideways. The side doors of the chopper flew open. For operators, Tier 1 Special Forces, bearded, heavily armed, and soaked in blood, leaped out. They weren't waiting for a gurney. They were carrying a stretcher between them, running with a synchronized, desperate urgency. On the stretcher lay General Magnus Thorne. He was a mountain of a man, but he looked small now. His gray tactical uniform was shredded. His right leg was a ruin of meat and bone. His face was gray, the color of wet ash. "We need a doctor," one of the operators screamed, his voice cracking. This was Sergeant Major Brick Wallance, a man who ate concertina wire for breakfast, but he looked terrified. "I've got him," Sterling shouted, rushing forward. "I'm Dr. Sterling, Chief of Trauma." "He's bleeding out," Brick yelled. "Femoral artery is severed. We have a tourniquet, but it's not holding. The shrapnel is high, up in the groin. Get him inside. Trauma 1. Move, move, move," Sterling commanded. They burst into the ER. A whirlwind of noise and violence. They slammed the stretcher onto the trauma bed in Bay 1. "Cut his clothes," Sterling ordered. "Type and cross-match. Get me a vascular tray." The monitors flared to life. The sound was a frantic, high-pitched whine. "Defib. No, tachycardia. BP is 60/40, a nurse screamed. "He's tanking." Sterling grabbed a scalpel. "I need to clamp that artery. Everyone back." He dove his hands into the horrific wound on the general's thigh. Blood geysered up, splashing across Sterling's expensive protective goggles. "I can't see it," Sterling yelled, panic creeping into his voice. "There's too much blood. Suction. More suction. Suction is at max. The artery has retracted." Sterling's hands were slick with blood. He was digging blindly, tearing at tissue. "It's gone up into the retroperitoneal space. I can't clamp it. If I can't clamp it, he bleeds out in 60 seconds. The general's eyes fluttered open. He was delirious, thrashing. "Ghost," he mumbled. "Find the ghost. Restrain him," Sterling shouted. "He's killing himself. He's asking for someone," Brick shouted, gripping the bed rail. "He said the ghost. He's hallucinating from hypovolemic shock." "You idiot," Sterling snapped. "Get out of my way. I have to open his abdomen to cross-clamp the aorta." "You can't," Dr. Chun, the senior resident, cried out. "He's too unstable. If you open his belly now, the pressure drop will kill him instantly. We have no choice." Sterling was sweating profusely now. The arrogance was melting away, revealing a terrified boy who realized he was about to kill an American hero on live television. Or at least in front of witnesses who would end his career. "Give me the laparotomy tray." "No." The voice was quiet, but it cut through the screaming panic like a razor blade. Sterling looked up. Standing at the foot of the bed was Alara. She had stepped out of the shadows. She wasn't holding a mop. She was holding her black, curved hemostats. "Get out," Sterling shrieked. "Security. Get this senile hag out of here." Alara didn't flinch. She walked toward the head of the bed. Her orthopedic shoes didn't squeak this time. She moved with a rolling, predatory gait, weight on the balls of her feet, center of gravity low. "Step away, doctor," Alara said. Her voice had dropped an octave. The rasp was gone. It was the voice of command. "Are you insane?" Sterling lunged at her. Brick, the sergeant major, stepped in. He had been trained to read threat levels in microexpressions. He looked at Sterling, hysterical, flailing. Then he looked at Alara, calm, deadly still. He saw something in her eyes. The 1,000-yard stare. The brotherhood of the damned. Brick put a massive hand on Sterling's chest and shoved him back against the crash cart. "Let her talk. She's a supply clerk," Sterling screamed. Alara ignored him. She looked at the general's wound. She didn't look at the blood. She looked at the geometry of the injury. "The artery didn't retract into the abdomen," Alara said calmly. "It snagged on the jagged edge of the femur fracture. It's twisted behind the bone. That's why you can't find it. If you open his belly, you kill him." She stepped up to the wound. "Don't touch him," Sterling yelled. I will have you arrested. Alara looked at her left hand. It was trembling violently. Hold this, she said to the nurse, handing her the suction wand. Then Alara closed her eyes. She took a deep breath. In the darkness of her mind, she wasn't in a Chicago hospital. She was in a cave in Kandahar under mortar fire, with dust falling from the ceiling. She was 30 years younger. She was the wraith. Focus. The tremor is fear. Fear is a reaction. Reaction is too slow. Be the action. Alara plunged her hand into the open wound. The room gasped. She's contaminating the field. Sterling howled. Alara didn't open her eyes. She felt the shattered bone. She felt the tearing muscle. She felt the heat of the blood. Her fingers navigated the anatomy not by sight, but by memory and feel. Femoral nerve, vastus medialis. There. She felt the faint, thrumming vibration of the trapped artery against the bone shard. Her hand was deep in the leg. The tremor in her arm was visible to everyone. It looked like she was having a seizure. Get her off him, Sterling commanded the residents. Alara's eyes snapped open. They were cold, hard flint. Snap. She clicked the black hemostats shut. The geyser of blood stopped instantly. The silence that followed was deafening. BP is rising, the anesthesiologist whispered, sounding like he had seen a miracle. 70 over 50, 80 over 60, we have a pulse. Alara withdrew her hand. The hemostat left in place, clamping the invisible bleeder deep inside the leg. Her hand was covered in blood up to the wrist. She turned to Sterling, who was standing with his mouth open, his sterile gloves clean and useless. He's stable, Alara said, wiping her hand on her oversized scrubs. You can do your vascular graft now, doctor. I suggest an end-to-end anastomosis. And be careful with the saphenous nerve. He'll want to walk again. She turned to walk away. Wait, General Thorne rasped. The general had regained consciousness as the blood pressure normalized. He turned his head, his eyes locking onto Alara. He saw the gray hair, the glasses, the stoop. But he also saw the way she stood. Alara? He croaked. Alara paused. She didn't turn back. My name is Martha, sir. She lied. I'm just the supply clerk. Liar? Thorne whispered, a weak smile forming on his blood-crusted lips. I'd know those hands anywhere. You're the wraith. You're the one who sewn my throat shut in Fallujah. The room froze. Sterling looked from the general to the supply clerk. General, she's nobody. She's a confused old woman. Thorne looked at Sterling with pure venom. That woman, he wheezed, has more confirmed saves than you have Instagram followers, you preening peacock. If she hadn't stepped in, I'd be dead. Thorne gripped the bed rail. I am invoking Article 9 of the JSOC medical protocol. I demand my own care team. He pointed a trembling finger at Alara. She scrubs in, or I walk out. She's not a surgeon, Sterling protested, his face turning purple. She's not even a nurse anymore. She has no privileges. Then give them to her, Thorne growled. Or I'll have this hospital declared a hostile zone and leveled by an AC-130. The hospital administrator, Mr. Henderson, a sweating man in a cheap suit who had been watching from the doorway, stepped forward. Dr. Sterling, Henderson squeaked, grant her emergency privileges. Now. But. Now. Sterling gritted his teeth. Fine. Scrub up, Martha. But if you kill him, I'm testifying against you. Alara looked at Sterling. If I wanted him dead, doctor, I would have let you finish operating. The operating room was a different world. The chaos of the ER was replaced by the cold, sterile hum of filtration systems. Alara stood at the sink, scrubbing her hands. The water ran hot. She watched the soap lather turn pink with the general's blood. Sterling was scrubbing next to her, scrubbing so hard his skin was raw. I know what this is, Sterling hissed. You're a fraud. You probably were a medic 30 years ago, washed out, lost your license. You think because you got lucky with a blind clamp you can play God? Vascular reconstruction requires microsurgery. Your hands shake like a leaf in a hurricane. You can't suture. Alara rinsed her hands. She held them up. They were still trembling. You're right, she said softly. I do shake. She dried her hands and walked into the OR. The nurse helped her into a gown and gloves. The general was under anesthesia now, draped in blue. Only his ravaged leg was visible. Scalpel, Alara said. The scrub nurse hesitated, looking at Sterling. Give it to her. Sterling spat, standing opposite the table to assist. Let her fail. Alara took the scalpel. As soon as the metal touched her palm, a strange thing happened. The tremor didn't stop, but it synchronized. Alara didn't fight the shake. She moved with it. When she brought the blade down, she timed the incision between the microtremors of her muscles. It was a technique she had learned in the frozen mountains of the Hindu Kush, operating while hypothermic. She cut. The line was laser straight. Retractor, she ordered. Sterling clumsily held the wound open. You're going too fast, he criticized. You're not dissecting the layers. We don't have time for layers, Alara murmured. His pH is acidic. He's coagulopathic. This is damage control surgery, not a tummy tuck. She worked with a speed that blurred the eye. It wasn't the graceful, balletic surgery of a university hospital. It was brutal, efficient combat surgery. She tied knots with one hand. She used the back of the scalpel to separate tissue. She ignored the small bleeders to focus on the killers. I need to harvest the vein for the graft, she said. I'll do it, Sterling said, reaching for the other leg. No, Alara stopped him. You'll take too long to find a pretty one. I'll use the synthetic. Pass the Gore-Tex. Synthetic carries higher infection risk. Better an infected live general than a sterile dead one. For 2 hours they worked. Sterling tried to find faults, but he couldn't. Every stitch held. Every decision was sound. It was unconventional. She used techniques he had never seen, improvised moves that belonged in a MASH unit, but it was effective. Finally, the graft was done. The pulse in the general's foot returned, strong and bounding. Closing, Alara said. She stapled the skin. No cosmetic sutures, just metal staples. Thunk, thunk, thunk. He'll have a hideous scar, Sterling sneered. He'll have a leg, Alara replied. She stepped back from the table. The adrenaline faded. The exhaustion hit her like a hammer. Her shoulders slumped. The tremor in her hand returned with a vengeance. So bad she had to clasp her hands together to hide it. You're done, Sterling said, ripping off his mask. Get out. I'll handle the post-op. And don't think this changes anything. You practiced medicine without a license. I'm calling the board in the morning. Alara nodded tiredly. Good night, doctor. She walked out, leaving Sterling alone with the victory he hadn't earned. The next morning, Alara didn't come to work. Dr. Sterling, however, was a busy man. He wasn't celebrating. He was hunting. He sat in the hospital records room with a private investigator he kept on retainer. I want everything on Alara Vance, Sterling said, his eyes bloodshot. Or Martha Caldwell, or whoever the hell she is. She humiliated me in my own or... I want to know why a woman with those skills is mopping floors. Did she kill a patient? Is she an addict? The investigator, a greasy man named Fitch, tapped on his laptop. I'm running facial recognition against the DoD databases. It's taking a while. Lots of firewalls. Break them, Sterling ordered. Printer word to life. A single page spat out. Fitch picked it up. His face went pale. Doctor, you need to see this. Sterling snatched the paper. Subject, Vance, Alara J. Rank, Colonel, Ret. Unit, JSOC/ESA, Intelligence Support Activity. Designation, Surgeon. Task Force 121. Status, Deceased. Classified. Deceased. Sterling laughed. She's not dead. She's living in a studio apartment in South Chicago. This is fraud. She's using a dead war hero's identity. He flipped the page. Most of it was redacted, black bars covering paragraphs of text. But one section was visible. Incident report, November 2004. Fallujah. Subject held position in a compromised field hospital for 14 hours. Performed emergency surgery on 22 coalition forces while under direct mortar fire. Sustained nerve damage to left arm from structural collapse. Refused evacuation until all patients were clear. Awarded Navy Cross, secret. Awarded Silver Star. Sterling ignored the heroism. He focused on the deceased status. She faked her death, Sterling concluded, a sinister grin spreading across his face. She's a fugitive. Maybe she stole drugs. Maybe she sold secrets. That's why she's hiding. I have her. He grabbed his phone. Get the board of directors. And get the press. I'm going to expose the fraud of the century. The hospital atrium was packed. Word had leaked that General Thorne had been saved, and the press was hungry for the story. Sterling had promised them a shocking revelation. Podium was set up. Behind it sat the hospital board, looking nervous. Mr. Henderson was wiping sweat from his forehead. Sterling stepped up to the microphone. He looked impeccable in a fresh Italian suit. Ladies and gentlemen, Sterling began, his voice smooth as silk. Yesterday, we witnessed a miracle. General Thorne was saved. But every miracle has a shadow. He gestured to a screen behind him. Alara's deceased file appeared. The woman who assisted me, a woman known to you as a humble supply clerk, is a fraud, Sterling announced. She is living under a stolen identity. The real Alara Vance died in 2004. The woman working in this hospital is an imposter, practicing medicine illegally, endangering lives. The crowd murmured. Cameras flashed. I have already contacted the police, Sterling continued, feigning sadness. It is a tragedy that someone would exploit the stolen valor of a fallen hero to cut the mic. The voice didn't come from the back. Came from the side stage. General Magnus Thorne rolled himself out in a wheelchair. He was pale, hooked up to an four-pole, but he was sitting upright. He was wearing his dress uniform jacket over his hospital gown. For stars gleamed on his shoulders. Behind him walked Alara. She wasn't wearing scrubs. She was wearing a dress uniform that looked like it hadn't been worn in years, but fit perfectly. It was deep blue. On her chest was a stack of ribbons that went up to her shoulder. At the very top, sitting above the silver star and the purple heart, was a light blue ribbon with white stars. The Medal of Honor. Sterling froze. General, Sterling stammered. You shouldn't be out of bed. This woman is a criminal. This woman, Thorne interrupted, his voice amplified by the silence of the room, is the only reason I am breathing. Thorne rolled to the center of the stage. He looked at the reporters. Dr. Sterling told you she is dead, Thorne said. That's partially true. Colonel Alara Vance died on paper in 2004 because the Taliban put a $5 million bounty on her head. They called her the White Witch because she could bring men back from the dead. The Pentagon erased her to protect her family. She gave up her rank, her name, and her life to keep her children safe. Thorne turned to Sterling. The general's eyes were like gun turrets. You called her a liability, Doctor. You mocked her tremor. Thorne reached out and took Alara's hand. He held it up. It was shaking. Do you know why she shakes? Thorne asked the room. Alcoholism, Sterling muttered, desperate. She shakes, Thorne roared. Because in Kandahar, she held a femoral artery closed with her bare fingers for 6 hours while buried under a collapsed roof. The nerve damage is permanent. She sacrificed her hands to save a 19-year-old corporal. That corporal was my son. The reporters gasped. Thorne reached into his pocket and pulled out a small digital recorder. My security detail records everything, Thorne said. Would you like to hear Dr. Sterling's leadership in the trauma bay? He pressed play. Sterling's voice, shrill and panicked, echoed through the atrium. I can't see it. It's retracted. I have to open the abdomen. She's a hag. Get her out. Then Alara's voice, calm and steady. Step away, Doctor. Sterling looked like he was about to vomit. He looked for an exit, but Brick and the other operators were blocking the doors, their arms crossed. Dr. Sterling. A new voice cut in. A tall woman in an Air Force general's uniform stepped onto the stage. It was General Holloway from the Pentagon. Your medical license is suspended pending an investigation into gross negligence, Holloway said coldly. Furthermore, you accessed classified DoD files without clearance. That is a federal crime. The MPs are waiting for you outside. Sterling backed away. You can't do this. I'm the chief of trauma. I saved him. You held the retractor, Alara said. It was the first time she had spoken. She stepped up to the mic. She looked at Sterling, not with anger, but with pity. Medicine isn't about the stats, doctor, Alara said softly. It's not about the clean suit or the magazine covers. It's about who you're willing to bleed for. She looked at her shaking hand, then closed it into a fist. My hands shake so others can hold their children. That is a trade I will make every single day. The room erupted. Not polite applause, a roar. Nurses were crying. Residents were cheering. Benny the security guard was fist-pumping in the back. 2 military police officers stepped onto the stage and took Sterling by the arms. As they dragged him away, kicking and screaming about his lawyers, the cameras turned to Alara. She didn't smile for the photos. She just turned to General Thorne, checked his foredrip and said, "You're leaking, sir. Let's get you back to bed." 6 months later, the name St. Jude Medical Center had been changed. It was now the Alara Vance Center for Trauma Medicine. Dr. Sterling was working as a claims adjuster for an auto insurance company in Ohio. He spent his days arguing with mechanics about bumper costs. Alara Vance did not become the chief of trauma. She refused the job. "I'm a field medic," she had told the board. "I don't do paperwork." Instead, she created a new position, Director of Surgical Resilience. She walked the halls of the ER no longer invisible. She wore a neat navy blue lab coat with her name embroidered on it. Colonel Alara Vance, RN, MD, Ret. She stopped by Trauma Bay 3. A young resident, a girl of maybe 26, was trying to insert a central line into a patient. The resident's hands were shaking violently from nerves. Sterling would have screamed at her. Alara stepped up beside her. "Breathe, doctor," Alara whispered. I can't," the resident stammered. "My hands. I'm too scared." Alara reached out and placed her own trembling hand over the resident's gloved hand. The vibration of Alara's nerve damage hummed against the girl's skin. "See that?" Alara smiled. "I'm shaking too. It means the adrenaline is working. It means you care." She guided the resident's hand. "Use the shake. Time the needle between the beats. 1, 2, strike." The needle slid in perfectly. Flash of blood. Success. The resident looked up at Alara with wide, worshipful eyes. "Thank you, Colonel. Just call me Alara," she said, patting the girl's shoulder. "Now finish up. We have incoming." Alara walked back out to the nurse's station. Benny was there eating a donut. "Quiet night, boss?" Benny asked. "For now, Benny," Alara said, adjusting her glasses. She looked at the inventory checklist on the counter. It was perfectly stocked. She looked at her hand. It was still shaking. She smiled, put her hand in her pocket, and walked toward the sound of the ambulance sirens wailing in the distance. The ghost was back on watch.